Okay, so now I have to compare the utilities, and then I see that the expected utility of Laura with the health insurance. Exactly. Well, let's see if that's higher than her utility without it. So without health insurance for Laura, it was 307.7. So then I know that Laura should buy health insurance at the fair premium price, because at that price, her expected utility is higher than without health insurance. Yes, because it is higher. That's correct. So the problem asks for an explanation, and then you may wonder that I took a bit of long to explain it, but that's because I'm trying to explain the rationale, right? Not just plugging numbers and stuff. But once you get the idea, I do find it relatively straightforward, since the math doesn't take long to compute if we have a calculator. And then we are asked to do the same for Helen. That's part D. We want to do the same. Although I still need to find a fair premium price for Helen. Notice that I still like this term. Even though I know it's going to be 0, I still like it because these are two extremes, right? Probably Laura, doesn't need to be in any of those extremes. Maybe she just wants to go for a checkup, and then that's going to cost some money, but not so much and not so little at 0. So in practice, I don't think the outcomes need to be so extreme. So maybe for a checkup, she would just have to pay $100, and then the insurance still would have some value to her. Okay. So here we have their premium for Helen is equal to the expected payout. There's a 75% chance that she would get a heart attack, and in that situation, she would get paid $96,000. Can you calculate the expected payout? So the idea there is, if Helen has a higher expected payout, we want to charge her a higher premium, correct? Basically, she's more risky. So again, if you're trying to pass on that risk to me, I realize, okay, you're in a more risky situation, so I want to charge you more to compensate for the higher risk. So investment instruments work in a similar way. So yes, in this example, again, two high extremes. Helen would be high risk, and then Laura would be low risk. Let's see. But at the fair premium price, Helen might still want to go for it. Might still want to buy health insurance. Let's check it out. In the case that, here really, regardless of the scenario, she'd have to pay $72,000, and then let's see what we have here. To keep it consistent, it's not going to affect the results, but I want to have the outcome where they get sick and then when they're healthy, just to be consistent. But it's not going to affect our results, okay? Just to be able to contrast the answers. Can someone find this one? By the way, this is just equal to the square root of 125,000 minus 72,000. Okay, because it's 75 cents of something, or 75% of the square root plus 25% of the same square root. It's just one square root. Let me just double check it. So that's 230.2. That's correct. So then I compare the utilities. 230.22. Is that higher than 216.11? And I say yes. So Helen should buy health insurance at a fair premium because the utility is higher. Any questions or comments? Okay, so let's move along then, because I want to be able to cover the whole worksheet. Let's see what we have. Okay, then it gets interesting. We have if Laura and Helen are put together in the same risk pool, okay? By the way, for Laura, who's low risk, that may not be a good thing because she knows that maybe she could do better on her own, correct? When you pool the risk with a more risky individual, then I'm not sure how that would help. Now, on the other hand, for Helen, knowing that she's a high-risk individual, it may help her to pool her risk with a lower-risk individual. And then it says which that now they each would have to pay $48,000 when they buy the health insurance plan. Okay. So this one, I thought we had to calculate what would be the fair premium if their risks were pooled together. But here we don't have to do that much. We're giving what they would each be charged. So let's do part E. So let me do expected utility of Laura with health insurance at the pool premium price, meaning both of them are put together, of $48,000. Okay, and I think you know where I'm heading. So Laura can get a heart attack with probability 0.25, and her utility would equal 0.25 times the square root of her income, which in this case would be $125,000 minus the premium of $48,000. And similarly, the idea is that in the case that she's healthy, she will not get any payment from the insurance company, but she will still have to pay a premium of $48,000, which those numbers sound pretty large to me. Okay. So again, that's equal to taking the square root of 125,000 minus 48,000. Okay. Only once. You don't have to do 0.25 times the square root plus 0.75 times the square root, because algebraically we know it just makes up 1. So then that's 277.49. Okay, any questions so far? So we see that this is less than 307.7, which was the expected utility of Laura without health insurance. So then we see that the expected utility is lower, so then Laura would not go in. Again, that makes sense. I mean, I'm not saying we knew the answer unless we carried out the computation, but at least we should have an idea, right? Logically speaking, if you're going into an investment project, do you want to pool risk with safer projects or with less risk, with safer projects or with more risky projects? So that's the idea there. Okay, so Laura will opt out. Now let's see if Helen would accept it. So Laura would not purchase at the price of $48,000. She will not purchase because the expected utility from purchasing, which would be having to pay $48,000 in each case, is lower. So don't get me wrong. When I say we want to avoid risk, I don't mean we want to avoid risk at any price. I just mean that we may be willing to pay some price as long as it's not so high in order to avoid taking on the risk. And one way to avoid taking the risk is to pass on the risk to someone else, okay, who could better afford the risk, like insurance companies, because they benefit from the law of large numbers. So here basically you have a consumer, right? And the consumer computes their expected utility with the purchase. And if they make the purchase, then the expected utility would be $277. But then we won't have to wonder, as a consumer, was I better with the purchase? Am I better off with the purchase? Or was I better off maybe not having spent my money in the first place and not having made the purchase? In this case, at that price, we're saying Laura would be better off not taking the purchase. On average. Does that make sense? Anything can happen, one or the other, but on average, she may be better off. But again, that's still a risk she would have to incur.